Emotional and mental well-being are factors that play a major role in the learning process. Students with stress, anxiety, and emotional challenges may have a hard time concentrating, which could affect grades. Today, we speak to Harford County Public Schools and some of their partners on what they're doing to address the mental health crisis right here in Harford County Public Schools. Join us in the next 30 minutes as we hear all about it. I'm Christy Breslin, and this is Harford MagaScene. Christina Alton is the supervisor for the social workers here at Harford County Public Schools, and she's joined us today because we are talking about mental health and how our children and their families are dealing with this in the public school system. Christina, thank you so much for being here today. And if you can kind of give us an overview on how mental health is affecting not only the children, but the families too.
How it's affecting our students, I mean, I think we can go back to COVID and we could easily blame everything on COVID, but we've seen issues with mental health for our children and their families since before COVID. And we see that in dysregulation of our students and just, it certainly impacts behavior of our students, whether that be acting out or inwardly shutting down, a variety of ways that it might show itself for our students. And we certainly have the resources to help families to access support if it gets to the point where it is impacting the day-to-day activities of our students.
And a lot of these resources you said from Harford County Public Schools are free resources.
Well, as a public school system, we have school counselors, school psychologists, school social workers. They exist in all of our buildings. But in addition to those free resources, as you say, because they do exist within our schools and all of them, we also have partnerships with outpatient mental health clinics in our community that students can be referred to, and they can receive therapy services in our schools. We also have a relationship with a care coordination organization called Care Solace, where folks in our schools or parents on their own can contact or can be referred to them. And Care Solace will do all the work for our families as far as finding a provider, because that can sometimes be the most difficult part. It's not easy to access mental health services. They exist, but it's not easy. So Care Solace makes those first calls for you. Who has openings? Who accepts your insurance? And then gives that list to families. Families do have to make the next call, which is to actually schedule the appointment. But all of that front work is done for you, which is sometimes the most difficult part. Once you have the appointment, you just have to get there. So it really has been a great partnership with Harford County Public Schools, and that is also free.
We love that. And let me ask you, what has contributed to the mental health crisis? Because when I was in school, it was nothing like this. It's a completely different world.
It is a completely different world, and when I was in school, I didn't have all of those things to deal with. And I really think that the impact of social media, it's easy to go there, but it's so true. Our students are getting messages about perfection. Everybody has a wonderful life. They're comparing themselves. They can see in real time friends go out and do things with each other. Why didn't they invite me? Is something wrong with me? And being a kid is really difficult anyway, teenagers especially. A lot of self-doubt and a lot of issues with self-esteem, and they're growing and becoming individuals of their own, but still concerned, am I being accepted by everyone else? And when you get all of these messages of perfection and everybody doing something fun, and here I am sitting home on a Friday night and everybody else is out, they didn't invite me. I really feel like social media has such a huge impact and influence, and everything they do is right there for everyone to see.
Right, I couldn't agree with you more. Now, if someone thinks, oh, I could use the help, but maybe they don't want people to know that they're asking for help, how do they do that without other people knowing?
I think in our schools, I trust our professionals. And if a family goes to, let's say, the school counselor or the school psychologist or a social worker, whichever support person you have a relationship with, they're going to keep that confidential. Nobody's going to walk in and say, oh, Christy Breslin asked me about mental health resources. That's not going to happen, but they are the best people in our schools to keep things confidential, but to go to because they have an idea of the resources, again, that exist within our schools. They can make that referral to an outpatient mental health clinic that they have a relationship with, Care Solace, or other community resources that exist because sometimes parents just don't know, and there are many here in Harford County.
Absolutely. Thank you so much for taking the time, and I really couldn't agree with you more on the social media aspect, but you are working very hard and partnering with some other agencies, and we're going to hear more about some of those partnerships and speak to some of the other professionals and get their vantage point on the mental health crisis here in Harford County. Now, as Christina has mentioned, Harford County Public Schools is partnering with several local mental health facilities to address the mental health crisis here in Harford County Public Schools. Stay tuned because coming up next, we're going to talk to Thrive Behavioral Health on what they're doing to partner with the schools and help the families. Keely Thomas is the program director here at Thrive Behavioral Health. They're a new facility. They really are bringing so much to Harford County, and she's here to tell us all about the mission and how they can help our residents. Hi, Keely.
Hi.
In your opinion, how does Thrive really benefit our community?
One of the things that we are here for is when people are experiencing those tough things, like the toughest moments. Most of the people out there, we're all very bright people. We're very smart. If it could be just figured out by looking something up online or reading something, a lot of the problems that people come to us for, they could solve them on their own. We really come in as people that have trained and have kind of known when people experience these types of problems or these sorts of things are going on, what other things have been shown to work? What is the research shown to work? What have other people taught us have worked in these situations? So we can come with these other ideas. When people know themselves, they know them families, they know their world, and then we can also come in with new ideas and help people kind of figure out exactly how can we make this situation better. Because a lot of times people are going through things that are just incredibly challenging, sometimes incredibly painful and difficult, and so it takes another person to come in and say, what might work? And sometimes those are things that we can talk through, like using talk therapy. Sometimes it is doing other interventions, such as through play therapy. You can look around our offices and see a wide range of toys. Sometimes it's using art interventions. We do have registered art therapists that work at Thrive, but also therapists that aren't necessarily art therapists will incorporate expressive therapies into the work we do. A big part of what we do is also connecting people to resources around us. Harford County is an amazing place to live and work. And so part of what we do is to also get to know other resources in the county and help connect people that may not know there's another support out there. So we do that work of bringing people together as best we can and kind of suggesting those things.
And one thing that is very surprising is the country is actually facing a shortage of mental health professionals. So how does Thrive support its team of professionals because of that?
We are very proud of our team. And so we do so many different initiatives to support our team. One of the things that we do is provide employee engagement surveys, and we recently did that between December and January, and the feedback was overwhelming. Most of our staff, I believe it was 96% recommended, 96% said they liked their role, they enjoyed their role here. 98% recommended us as an employer. No one, the people that didn't recommend us, they were in the middle. There was no one who didn't recommend us. And when we asked those individuals, why? Like, what is it about Thrive that you love so much? The number one answer was support. That means to me the supervisor is one of the things. So we have a supervisor that meets closely with our staff. For newer therapists and clinicians and staff members, it's weekly. Once people know their job, it might be more like once or twice a month. We have a variety of affinity groups. Like we have a Black professionals affinity group. We have an LGBTQIA+ affinity group. We have other support meetings in place. We listen to our staff. We are consistently adding in new trainings that are very exciting. We had over 20 staff trained in an evidence-based program called Unified Protocols last week. And we have ongoing trainings that are happening all the time. So we just really try to engage people and be there. And we do super fun things. One of the things we always say in this field is therapy, yeah, it can be really hard. You can talk about tough things. It also can be really fun. So we try to make this also be a place that is fun to work and there's a sense of community.
Well, we're going to talk about how Thrive partners with Harford County Schools and how it can benefit you and your family. Stay with us. Now, we have talked about the importance of these programs and why they are necessary for the families and, of course, the children that are experiencing mental health challenges. So how do we obtain these services and what are the first steps to take? Take a listen. Kelly Smith is the school coordinator for Harford County Public Schools, and she works very closely with Thrive to help students and the families in our community, and they're really making a difference right here in Harford County. She joins us today to tell us all about it. Hi, Kelly.
Hi, how are you?
Great, thanks for being here.
Thanks for having me.
Now, Kelly, tell me about your role as a school coordinator.
Sure. I work closely with the liaisons in the schools. So typically they are going to be your guidance counselors. Sometimes it's a vice principal, and they make the referrals for their students right to our agency through our website.
And you have a fantastic partnership with Harford County Public Schools. How did that come about?
Sure. We have been serving Harford County at Thrive for many years now out of our Rosedale location. So we thought it would be important to kind of spread and come into Harford County so that there was a home base here for our current clients to be seen here as well.
Why was Harford County Public Schools chosen? Was it because of the growing population?
Well, it was chosen for a lot of reasons. Like I said, we have clients that were already coming to see us. I also have a history of working in Harford County Public Schools as well. And I'm a Harford County resident, and my daughter went through the schools, and I've seen how important that these services can actually be.
Well, talk about the importance of the mental health programs.
Sure, absolutely. The current data is saying that 1 in 6 children have a mental health diagnosis. Sometimes that can be, just adjustment disorders, anxiety, depression, those kind of things. And only about half of those kids are actually in treatment. So it's really important to partner with the schools so that we can kind of have other eyes on the students to be able to refer them to get help as soon as possible.
Now, what are the benefits of school-based programs over clinic-based programs?
One of the major benefits of that is kind of access, right? So the kids are going to be at school, and then they don't have to miss a lot of instruction, and we can work closely with teachers, with behavioral support systems, and kind of have eyes on them in real time.
Now, what about the process for school-based referrals? I mean, how does that start? How does it begin?
Well, it begins, like I was saying before, a lot of the schools have a liaison. So that is somebody that is identified in each of the schools to make those referrals. And sometimes it'll be come from the school nurse and the kids that are chronically going in and out of the nurse's office, or behavioral concerns in the classroom, or attendance issues, or those kind of things. So it kind of is a team approach that the schools identify somebody that will take the lead on that.
Now, Kelly, what happens when schools are closed? Are the services still available?
Yeah, so we have the office here in Bel Air that we can see our students. We also utilize telehealth through Zoom, so people can be in their own home and still receive the services.
Now, you offer additional support, and not only for the students, but for the families too. Tell us about that.
Absolutely. Additionally, we have medication management through Thrive. So we have psychiatric nurse practitioners and psychiatrists that can meet with the children and families to provide medication management. And we also can see other siblings that are in the home, as well as their parents. So we can treat the entire family, and often do.
Well, coming up next, we're going to find out who is eligible for the services and how you can obtain them. Stay with us. Asking for help and getting help is not always an easy task, but it is something that will help our children with their education and, of course, give them a peace of mind. Take a listen.
Megan Holter is an intake coordinator here at Thrive, and she's basically here to tell us about all the services they provide and what to expect when you first call to obtain their services. Hi, Megan.
Hi, how are you?
Good, thanks for being here.
Thank you for having me.
Now, Megan, you're an intake coordinator. What exactly does that mean?
So we typically are the first people that potential clients speak to. It's like 3 of us. So we get demographic information, insurance information, ask screening questions to make sure they're not in crisis or thinking about harming themselves or others. And then we also ask them, why they're calling, what is going on, why they're calling. We don't ask for like specific details, but we do ask like, what is your reason for calling for services? And then we process them, and then our clinic directors assign them to intake therapists to reach out, and it's typically pretty quickly.
What are the requirements to obtain services here?
So currently we take Maryland Medicaid insurance. We do take some commercial insurances, but we have a limited amount of available therapists. So we, for that, we mostly take the Medicaid, and then we attempt to try and find an available therapist for anyone with commercial coverage.
So if a client isn't eligible for services with Thrive, then what happens next?
So typically, if they're not eligible for services with Thrive, like for insurance reasons, I call every couple of weeks. I call the local outpatient agencies to see who's accepting clients, what type of insurance, what what times they have available, so that we can provide that information to anyone that we can't provide services to. Or if someone is not typically if they don't fit the criteria for our program and they may need a higher level of care, our therapists and treatment teams refer them out for the higher level of care.
Now, what are some of the other ways the administrative staff actually interacts with the clients?
So we do, starting last year, we decided to do a back-to-school resource fair where we provide backpacks with school supplies. There's free haircuts, snowballs, crafts, and then we also invite various resources in the communities that we serve to come out. Otherwise, there are some resources that the families don't know exist, because they're not exposed to them. So we do have several PRP agencies. We have the outreach team from Baltimore County Police Department, the local precinct, and then we also have the firefighters come, and they do like a Stop the Bleed training.
How do you, at the initial phase of treatment, work with the schools to bring a client in?
So typically I let them know I received the referral. If there are any barriers, if they didn't include insurance information or the client has an open authorization elsewhere with another provider, any barriers that I can't initially process the referral, I'll let the school know. I'll let them know that I reached out to the family, and that when I'll be doing another follow-up, and typically the schools do say, I'll reach out to mom. Since you left a voicemail, I'll reach out to mom, have her call you. And then, we collaborate that way to get them their services as quickly as possible.
Now, what is the importance of school-based mental health programs and the stigma surrounding it? We'll find out next.
There are many stigmas surrounding mental health and a lot of common misconceptions. Coming up next, we're going to address them to find out what is true and what is false.
Jessica Kaye is a clinical social worker here at Thrive, and she's here to tell us how they can help you and your family if you're going through a tough time, because as we know, mental health is a priority here in Harford County. Hi, Jessica.
Hello.
Jessica, why do people like talking to a therapist? What would you say are the benefits of it?
Well, it's quite simple. Our role as therapists is to provide an environment so someone can talk openly and not having to worry about them being judged. We're objective, we're not judgmental. And second, our role as therapists is to help people of all ages live a happier, healthier, more productive life. We teach them new skills to better cope with whatever challenges may arise. And not only that, but this shows and this encourages a person to show up to their sessions on a weekly basis so that they can be in a safe environment where they can look at problems in a different way and with someone who will respect them and respect their opinion.
Well, Jessica, it seems like nobody has problems talking about physical health stuff, but mental health is a different story. People don't really want to talk about it. Why is that?
Well, mental health concerns are very common in our modern day society. I will say there is a lot of stigma and discrimination going around it, and this makes people feel shame. There's criticism and there's self-doubt, which limits them to want to talk about it openly. However, our brain health is just as important as our physical health concerns are because it involves our emotional, psychologically, and as well as the social well-being. It affects how we think, how we feel, how we act. So it's very important for us to start to talk about how we feel, talk about our mental health, normalize it on a daily basis so that people feel more comfortable talking about it, and not only that, but they feel more encouraged to seek the support they need.
Now, you've talked about the stigma surrounding it. I've heard it. We've all heard the stigma. But what are some of the common misconceptions regarding mental health?
Well, I think it's very common to hear people say mental health services are only for crazy people.
Yes.
And I think that comes from lack of understanding and knowledge and not being educated on the matter. So when someone hears that kind of connotation, then people shy away from seeking support because they don't want to be seen as crazy. That will be a big one. I guess also that we don't normalize that our brain requires the same attention as any other part of our bodies. It's very normal to receive treatment to help ourselves lower cholesterol or manage our blood sugar. But then we have not normalized for a long time the need of our brain to receive the care it deserves.
Now, that brings me to my next question. Is there a stigma around taking medication for one's mood or brain activity?
Yes, and a very common misconception is that psychiatric medication will affect the ability of a person to be themselves or just be them. However, the majority of the people taking psychiatric meds actually find themselves being themselves because they are receiving the care that they need. We take medication, like I was saying, for physical health concerns, so we shouldn't be disregarding or minimizing medical conditions such as our brain to treat anxiety, depression, bipolar disorders, or other conditions. If medication is what will help us be our best, we shouldn't be minimizing the help that it could give us.
You mentioned mental strength to me. How would you explain that, and what is the importance of it?
Well, mental strength is the ability for someone to consistently and persistently go through challenges despite things becoming hard. And how can someone develop mental strength? There's different ways and techniques: meditating, doing self-care, making sure you're creating meaningful relationships, accepting failure and understanding that's part of life. And someone who creates mental strength also is more likely to go through their goals, pursue their goals. So it's important because the outcomes are just tremendous, like the ones I just mentioned to you.
Obviously, mental health challenges can take a major toll on not only the student, but the families as well. How do we engage the families in the healing process? We'll explain.
Jean Sweeney is a mental health therapist here at Thrive, and she's here to tell us today about some of the sessions that they do and some of the tactics that they use to help not only the students, but engage the families as well. Thanks so much for being here.
Sure, thank you.
Now, Jean, for all of us that aren't familiar with the lingo surrounding mental health, what is RPT?
So that stands for a registered play therapist. And so basically what that is I work with mainly children, elementary school. And so you have to go through this pretty intense certification program. And so it's kind of like how with maybe older children or adults, you might like be having therapy sessions where you're, talking. And this is more where they play. So it's like the language of children is play. And so I have like all these different types of games. So like one would be Candyland. So when they, when we're playing the game and they land on red, then I go into like, okay, so red sometimes could stand for anger. So tell me a time when you were feeling angry about, whatever has been going on in your life or whatever, like that. And so I do that with mainly all of the games that I have. And so sometimes I'll use puppets, or I have like this sand tray. So it looks like a big box filled with sand, and then they can put like different types of figures in there. And like we say, it's like they build a world. So like if they were traumatized, sometimes it's hard to talk about that. So then what they'll do is they'll act it out in the sand. So,
That's a great method.
Yeah, really. It is. It's very, very interesting because I'm not supposed to like analyze anything or assume anything, but like I know their background. And so I'm like, I have an idea as to why they put this there or that figure over here. Or sometimes they'll like put a fence in, or like I'll have a dragon or someone that looks like, a creepy person, and they might identify that as somebody who traumatized them, or, maybe somebody who just, is someone that they don't like in their lives.
Oh, absolutely. And that, one of the things that I wanted to talk about is how do you engage the families in the healing process?
So basically what initially happens is I do the intake, and that is with the guardian, because we don't want to assume it's the mom or the dad, because sometimes they might live with their grandma or their aunt or, somebody else. So we just basically say the guardian, and they're with the child completing the intake. So I get to know them that way, and then I'll say, we do provide monthly family therapy. If you could do that, if you would be available, because of a lot of these families work now. It seems to me, as again, I've been working in the field for quite some time, it seems like families, just work more than maybe they did. That's just kind of the feel that I get. I don't know. So anyway, if they are working, then sometimes they might, say I'm not available. Sometimes it is difficult to engage, the families, but I try to, be in contact with them, whether it is through a phone, text, or doing a family session.
Well, if somebody is interested in getting some of your services obtained, how did they start the process with you?
So basically what happens is our intake coordinator is the one who would receive the referral from the school. And that's either through the teacher, the principal, the school counselor. And so then they go through all the authorization through the insurance company. And then once that's all said and done, then I would contact the guardian. And then I would set up a time for the three of us, the guardian, the child, and I to meet. And then we go through a lot of the background. And one of the first things I ask is, what brings you here today where, you feel like your child needs counseling. So then we get into all that, and that's kind of how the process works.
As you've seen today, our schools play a major role in helping address the mental health concerns of our children and families right here in Harford County Public Schools. If you would like to learn more about their efforts or maybe take advantage of some of the resources, you can always reach out to them at hcps.org. I'm Christy Breslin. We'll see you next month on Harford MagaScene.